Hi, Dr. Garima here, and today we are just going to brush through the recent guidelines and the updates that the Australian Dental Council has released like 2 or 3 days ago. One new thing, surprising thing that they have done is they have released around 40 scenario based questions, which is like a practice question paper, so as to make aware to all the candidates how the exam questions would be like, because the new candidates just don't have any idea how it would be like. Only the repeat candidates have an idea because they have given it an exam. And so far from the official Australian Dental Council website, nothing of this sort had been released. So we'll be going through that in like 5 minutes, where I'll be solving just one scenario. So there is one scenario, there are 5 sub-questions, and just as I have solved the other question papers, we are going to solve this one too with my analysis of how to solve it. And pretty much I myself went through the paper and I applied my analysis and I got like almost all of them correct. So that reinforces, my past ways of solving the paper. So if you have seen my previous videos, you will find that it's practically no different from this video either. But it's just that this time I'm solving on the official practice questions that the ADC has released, and so you'll find the similarity and it would reinforce the faith in you about how to solve the questions, right? I was also going through the other stuff that they had given, and there are a lot of them, and one by one in videos we'll take it. But right now for today, just trying to reiterate how the questions are marked and how many percentage of each questions are there. So this is from their website, okay, and they have given that these many topics would be asked and this is the percentage of questions. And restorative dentistry, that is which includes fixed prosthodontics, I know that's a pain point for everybody, is 12%. So maximum questions would be based on restorative dentistry, okay? And then you have removable prosthodontics as a different thing. So imagine 12 plus 6% is 18% of questions on restorations. So important. You need to get these questions right. Radiography, preventive dentistry, pain and behavior management, and pediatric is 8%, oral medicine and pathology 9%. Then you have implants and pharmacology 10%, and where they will ask those BRONJ, MRONJ questions. Now the important point is you have 280 questions, okay? 70 questions in each paper, there are 4 papers. 240 questions would be marked upon and 40 are unscored questions. Just remember this. 40 is a big number. 40 questions are unscored, meaning they can have more than 2 correct answers. So if you are stuck in some questions and you feel there are definitely 2 correct answers, do not break your head over it. Just mark whichever you feel is correct and move ahead. Probably that question would be unmarked anyways, so there is no point breaking your head. Try to mark those questions very correctly where you for sure know is only one answer is correct, 40 is a huge number. Imagine 40 questions straight away unmarked for everybody, not just you. So remember this, that though the question paper is for 280 questions, you will be marked only for 240 questions. The 40 questions which are unmarked, you won't know, of course. All right. So that is it. And now coming to the most asked question and the most confusing question for everybody, how is the passing standard set? So what they have written here is that you have to meet the standard of the minimally competent recent Australian dental graduate. This is determined by the modified Angoff standard setting methodology and the test equating with Rasch modeling item response theory. Do you understand this? No. Do I understand this? No. So basically for each exam, they will be taking the standard of the minimally competent ADC graduate which has passed out from their university. Now there may be hundreds of universities. Which candidate they are going to take as the minimally competent one, God knows. Basically this is where there is lack of transparency. They won't tell you that for each paper, if there are 70 questions, they have set the passing standard as 35, 40, 30, 50, you have no idea. And for each exam it would differ, for each paper it would differ. So there is no way of knowing which is the minimum passing score. only they know it, and this is where I feel this is very non-transparent method, and they can play with this anytime they want, because they won't release what is a minimally competent Australian dental graduate at that point of time. So that's why I always feel that it's not a transparent exam, it's not a fair exam where they have disclosed you. But if you have to live in Australia or you have to clear the exam, then you have no other option but to give the exam, correct? So anyways, having seen this and having understood this, this is all mentioned on their website, okay? You can just go ahead and download it. Let's go to the practice paper. So this is the practice paper, and they have given like 200 questions, 40 scenario based questions. We are going to solve scenario number 1 in this video, and let's start. And like I said, you can compare this video to my any given previous video of other mock exams that I have been solving so far, and you'll see the similarity that how I have been solving those questions and reaching answers, and how I will be solving these questions and reaching the answers. The good thing about these questions is that they have given the answer key, which is mentioned at the end of the PDF. So you can see how I've reached the answer, and then you can compare the answer to the answer key and understand why I've chosen this answer, correct? And if you follow the same methodology, then you can solve all the marks and you can be confident for the exam. So Nancy is a 45-year-old female who has tooth pain every now and then. Okay, so it's pretty frequent. And now and then, and is unhappy with the way her teeth look. Okay, now they have given these pictures. This is how it would be in the exam in the scenario. Her last visit to a dentist was 6 years ago, so she's pretty irregular, at which stage she had no obvious dental disease. Nancy is taking a beta blocker for hypertension, started 3 years ago. So 6 years ago she visited the dentist and apparently there was nothing. 3 years ago she started beta blocker for hypertension and she did not visit the dentist after that. And the hypertension medication was started by the general practitioner. Now this is a very important keyword. Okay, keyword, I wouldn't say keyword, I would say it's a key sentence. Why? Beta blocker for hypertension. Hypertension mostly is related to stress. Further, you're giving beta blockers which can result in decrease in salivary production. And when the salivary production decreases, cavities do occur. That is the connection to it. So you have to have this theory knowledge that beta blockers does cause decrease in salivation. It causes dry mouth. Stress also causes dry mouth and hypertension, and both of these together can lead to caries. Now this basic knowledge you should have, then only you can link to this sentence as to why this sentence is given. See, in the exam, every sentence and every keyword and every word that is given is directing you to something. Now it's your job to understand where it is being directed at. Nothing is a waste, nothing is useless, nothing is a nonsense sentence to waste your time. Everything is important. It would either add to your diagnosis or eliminate some other disease from your diagnosis. You understand? So having this sentence given by them becomes very important. Okay, now let's see. We have seen the photographs. You see there is a lot of caries here and there. There are missing teeth apparently, and it's a crowded arch, not that great. Oral hygiene looks okay-ish. You can see a bit of plaque and calculus deposits here and there. So fair enough, you have seen this, and now we'll jump to the questions. So each scenario will have 5 sub-questions. Each sub-question, they have made it 4 options, which is great. Some of them can have 5 options. In my exam, all the sub-question had 5 options, which was too much to go through. But apparently in the newer exams that the candidates are giving, they are given 4 options or 5 options. But there are questions with just 4 options also. So that's a great advantage, you know. So anyways, let's start solving sub-question 1. Nancy tells you that she is keen to regain her oral health so she can eat properly. Okay. What is the most likely explanation for the recent deterioration in her dental health? Most likely, adjective. That means all can be correct. You have to choose the most appropriate answer. Keyword, keyword, keyword. Moving to a non-fluoridated community. Did your scenario mention that the patient has moved here and there? Huh? So don't jump to a conclusion. Plus, if somebody is moving to a non-fluoridated community, doesn't mean that all the people out there will be suffering like this. So this is out of question. Changes in her saliva. What did I mention in the start? Beta blockers, decreased salivation, dry mouth, caries. Previous history of poor quality restorative treatment. Option C. You could have considered that, but what is your scenario saying? Her last visit to a dentist was 6 years ago, at which stage she had no obvious dental disease. The question is clearly saying that she had no obvious dental disease. So then this option C is again not fitting here. Using a hard bristle toothbrush. Toothbrush is not going to cause you caries. It will cause abrasion. We have caries, frank caries, gross caries, correct? So obviously the answer is changes in her saliva. Even if you did not know this answer or you were doubtful about it, the rest of the three options straight away you can just eliminate. So either you can reach your answer by knowing the answer, or you can reach the answer by eliminating the other options. Either way you can reach the answer of changes in her saliva, and that is what is given in the answer key, correct? Go ahead, watch it and understand. Does it make sense? It does. Now let's move to the second question. Nancy indicates that tooth 2-3 gives her pain every now and then. This canine. It looks carious even on this view and this view, like gross caries, and it seems like it's probably invading the pulp. In addition to the pulp sensibility testing using dry eyes. So the question says you are going to do that, and in addition to that, what other clinical investigation would most assist in making a diagnosis? Basically what the question is trying to say is that you have to figure out, as it is there is pain in the tooth and every now and then, that is a tooth giving her pain every now and then. When a tooth is with caries and you see it's a gross caries, and the patient also complains that there is pain every now and then, frequent, you will think there is some pulpal problem going on. Now apart from pulpal problem, what other problem can be going on is a periapical problem, if a periapical lesion has started or not. Pulpal problem you can know by doing the pulp sensibility testing by dry eyes. That's your carbon dioxide, at a very low temperature. And what you have to do is you have to apply that endo ice. Now the tooth may respond, the tooth may not respond. Now you also have to see if there is a periapical problem happening, and how would you know the periapical problem happening? You can take a radiograph, or if you're doing the clinical testing, you will just tap on it, basically do a percussion testing. Periodontal probing, the option number A, is doable, but I would come to that later. And periodontal probing not necessarily would give me the state of periapical infection, correct? That would give me the state of the periodontium. I want to see the periapical. I'm not interested in seeing the lateral things of the tooth as of now. Sensibility testing using hot water, that can also be done, okay? But that is usually done when there is almost necrosis or an abscess which is about to develop. Otherwise, it's not going to give you a good result. Percussion testing will give you the periapical result. Also, in sensibility testing using hot water, it would still give you the pulpal result. It won't give you the periapical result. And to reach a full pulpal and periapical diagnosis of the tooth, you have to do the pulpal testings and the periapical testings. Trans-elimination and mobility testing. Trans-elimination would still give you a crack or some caries detection, but that won't give me the pulpal status or the periapical status. Mobility testing would definitely give me periodontial status, but not necessarily just the periapical status. Why am I forcing you to understand the periapical status? Because any diagnosis of a tooth is a full pulpal and periapical diagnosis. Even if a tooth is good, you will say this is a healthy vital pulp with a healthy periapical status. Or if the tooth is having irreversible pulpitis with a normal periapical status, your full diagnosis is irreversible pulpitis with normal periapical structures. If there is a periapical lesion and the percussion test is positive and the pulp is also kind of say irreversible pulpitis, then your diagnosis is irreversible pulpitis with periapical inflammation. You understand? So that full diagnosis comes, and that's why the full diagnostic testing has to be done. So all the other tests are also great, but the question which is asking you very specifically, most assist in making a full diagnosis You have already done the pulpal testing. The next is periapical testing, and that comes with percussion. Hence, the answer is percussion testing. Understood? Question number 3. What restorative principle is the most important in ensuring a favorable prognosis of tooth 2-3? Sounds like an easy question, but the options can confuse you, you know. It says restorative principle. Okay, let's understand restorative principle. What is a restorative principle? You have to make sure that secondary caries should not develop by any marginal leakage, because that is one thing which can screw up your restoration. So the most important thing is to have the marginal seal intact. Okay. Now you may get confused here in total caries removal and obtaining a marginal seal. Total caries removal, even if you remove the total caries but you're not ensuring the marginal seal, there would be development of secondary caries for sure, and your restoration can fail. So that is a good principle, but that is not the most important principle, and the question is asking you the most important principle. You understand? Whenever a question says most important, it means probably all the options are correct. All are principles, but which is the most important principle is obtaining a marginal seal, you know. Total caries removal, I can further debate on that sometimes you leave arrested caries inside. You're not actually removing the arrested caries because it does not need to be removed. So total caries removal further is not necessarily an ideal criteria. You can still leave a bit of arrested caries and obtain a good marginal seal, and your restoration would be nice for a long time. Shade matching and establishing canine guidance are secondary structures. Like, you can match this shade, but that is not the most important thing. I mean, there is no point matching the shade like perfectly and leaving caries, you know, infected caries inside, or not obtaining the marginal seal. Hence, obtaining a marginal seal is the right answer of choice here, which is also given in the answer key. Nancy asks you about full mouth vital tooth bleaching, as she has seen advertising, which has convinced her that she needs to have it done. Okay. She saw some white teeth and she saw her teeth and she thought, okay, you know what, if I whiten my teeth, I'm gonna look that nice because I'm not happy with the look of it. She's unhappy. That is what the scenario mentions. This is exhausting, isn't it? Imagine you're sitting at the exam hall and you have to solve like 70 of such. Your brain is at full capacity functioning. You know, you actually have a burnout. You know, in the exam, even I was sitting like this for 5 seconds, like just closing my eyes. I'm like, what the hell? But it was fun. It was like every minute was a challenge. Every second my brain is active. I'm drinking water 10 times, you know, just to reoxygenate myself, so I don't like go swayed in the question and fall into any trap, you know. So anyways, let's go back to the question. If Nancy opts to proceed with this, what is the most appropriate stage of treatment for her to have this done? Okay. Now she thinks she wants whitening, and you kind of agree with her. But at what stage are you going to do the whitening? If you start her treatment, you're gonna start whitening at this stage, correct? You have to first remove caries. Say you remove the caries, and then you have placed, say, temporary restorations. Like you have decided, you know, such kind of teeth. Definitely, you cannot just put composite or GIC. You would need to give a crown, you would need to give a laminate or something. This is like a completely discolored tooth, correct? Now, crowns and laminates are like definitive restorations. GIC in permanent teeth is considered as a temporary restoration. You can even say a composite restoration in such a scenario would be a temporary restoration, because you still have to give crown because there is gross morphological damage to the teeth. Now, there are certain teeth, for example, this tooth, 1-3. Now that doesn't require any crown or something. So, but you need to match the restoration to that tooth also, right? The rest of the restorations. So when are you going to whiten this teeth, the other teeth, basically, so that their color matches that of the future restoration that you're going to put on the caries teeth? So first you are going to remove all the caries, then do temporary restorations. That is either GIC or composite. Then you will whiten all the teeth. Then once everything is whitened, then you will match the shade of the other whitened teeth with the ones you wish to replace with laminate or crowns, correct? Understood the steps? So let's see the options. prior to any other treatment. No, you cannot whiten the teeth with caries still present in the mouth. You have to remove it first. So that is not the right answer. Immediately after removal of all calculus, again, you still have not removed the caries. Wrong option. After the placement of temporary restorations, yes, correct option. After the placement of definitive restorations, it means that you have done crowns and laminates and now you're whitening the teeth. The crown shade is not going to match with the other teeth shade then. More problems later on. No, that's not the right option. After completing all other treatment, means what? You are still finishing the rest of the treatment and then you're doing the whitening. No, not the right answer again. After the placement of temporary restorations, you have to do whitening. And then you have to wait for 2 weeks for the whitening shade to settle down and then you proceed with your definitive restorations. Understood? Nancy also mentions she is interested in having teeth 1-4 and 1-5 replaced with implants. Okay, let's go back. Here, this area. Apparently, tooth has been extracted a while ago. This area seems very healed. You can see a little bit of depression here because the teeth were not there, so alveolar bone loss has happened. Now she wants it replaced with implants and crowns. Her friend had recent successful and aesthetically pleasing implant placement for her upper 2 incisors. What is the most likely issue that may impact the ability to proceed with implant placement for Nancy? Most likely issue, again adjective. Whenever there is most, initial, best, least, except, pay extra attention. Usually these questions are good, you know why? Because they have one option which is correct. You don't have 2 options which are correct. So that's a good thing about these questions. Bone quantity may be inadequate, probably. Mesiodistal space may be inadequate. It doesn't look like looking at the picture. Vertical space may be inadequate. Where's this going? Okay, let's go back to this picture. Vertical space. Yeah, there is quite a lot of vertical space in the picture. Mesiodistal space, it's enough for 2 premolars. I don't think so this is less. This is quite a good space actually. So I'm not going to go with those options either. The maxillary sinus may extend to the premolar region. Possible. I can be confused between option A and D. But do I have the radiograph to choose option D? Has the clinical scenario given me the radiograph? No. So even though my option D can be correct because I don't have a radiograph, I just have a clinical picture which does show kind of depression in that region, I'm going to go with option A. Understood? So that's how you choose answers for the questions. It's interesting, it's challenging. I like the written part of the ADC exam. I don't like its passing criteria because it's very untransparent, it's very unfair, I would say. But it is what it is, like they say. Otherwise, how it's a business for them, because it's a pretty expensive exam, and if you pass in the first attempt, then how will they make more money out of you? So anyways, the passing percentage is also less. It's less than 15% apparently. And the last exam was quite tough, but it is what it is. So anyways, we'll go through clinical scenario 2 tomorrow. You see, each scenario does take time, but in the exam you are expected to solve each question, that is one sub question, within like 1.5 minutes, because you have 70 questions and you just have 120 minutes for each paper. 2 hours, yes, day 1 and day 2. So 2 hours for 70 questions, which means 120 minutes for 70 questions, which means less than 2 minutes per question. You understand? And in that you have to read the clinical scenario as well. Clinical scenario is not a question. Clinical scenario is just a scenario. The questions come after that. Correct? So yeah, you have less than 2 minutes to solve each question. So you have to be pretty fast, bang on with your concepts, with your clinical knowledge, application, and be very, very careful in choosing the keywords, because that would determine your answer. And the only way to achieve this is practice, practice, and practice. That's why they have given you this practice paper. But this practice paper alone is not enough. You need to know more practice questions which have been given in my mocks. I have 33 plus mocks, each mock having 70 questions, so there are thousands of questions out there. All the past ADC papers basically, and then you need to know your basic dental concepts, for which we have the comprehensive book and the ultimate ADC companion book. Go through it in my other videos and you'll get to know more about it. You can email me on adcwrittenmocktest@gmail.com and I can share more details with you. And yeah, again, I look forward to your comments. Always happy to see them, and have a nice day. Bye bye.